the North Central Regional Center for Rural Development, and I'm pleased to be your moderator today for this webinar on exploring community interest in behavioral health via Google Trends. Feel free to enter any comments and questions you have into the chat box as our presenter speaks, and we'll try to address the questions as they come up. I think with that, we'll just turn it over to Jessica Tess, who's our presenter today. Jessica is with the Community Assessment and Education to Promote Behavioral Health Planning and Evaluation Project. It's a national project involving the 4 regional rural development centers. It's funded by the Substance Abuse and Mental Health Services Administration in partnership with the USDA NIFA. And with that, I'll turn it over to Jessica.
Yes, thank you. Hello, everyone today. And so given that, a quick thank you to our sponsors. They're listed here, except our logo for the USDA is missing. Sorry about that. That should be here. They're also among these other 3. So very quickly, I'll just give you a brief introduction. Today, I'm going to be giving this presentation on how to use Google Trends in the context of community behavioral health. If you're unfamiliar with Google Trends, it's great you're here today. In short, Google Trends is a way to look at online interest in topics over time and by location. I'm talking about this with you today because Google Trends is a publicly available tool. Anyone can use it, and it can be a very nice addition in your toolbox working with community behavioral health, or to have as another reference point, if you will, if you're looking at different types of data on your community in relation to behavioral health. So today we're going to be talking about how if by looking at behavioral health topics online via Google Trends data, you can see what people are interested in, then you may be able to gain some further insight into what people can be, into dialogues you can create with people, or what you can reach out about with different topics or issues or concerns in your area that you're trying to address. So that being said, there are a lot of features to Google Trends, and so I'm going to give an introduction to as many as I can, and I'm going to be using a share screen that I'll bring in a few minutes to show you examples in live time as we go. So feel free to ask as many questions as you like along the way in the chat box, and I'll try to notice them and not miss them. So without further delay, we'll get started. So very quickly, what I'm planning to go over today, you can see in this list, we'll go over the basic components of Google Trends, and that's honestly the largest part of this presentation. As I said, there are many features. I'd also like to give an in-depth discussion of the types of search terms you might be inputting into Google Trends and how that can affect the results you might get. We will, of course, discuss some limitations to Google Trends because there are a few that are important to know. And we will also talk about some specific ways you can use Google Trends data in your work with community behavioral health and with partners in that type of work. I'm going to cover all of these things by using examples from our CAPE pilot communities. And as Dr. Leverage said, CAPE is dedicated to identifying and sharing best practices for benchmarking community behavioral health. Currently, we're working with 10 pilot communities, and so I'll be highlighting a few examples that we've been looking at from our work with them. So a little bit more about Google Trends in terms of what it is. This is what Google Trends has to say about how you would describe it. So Google Trends, as you can see, I've got the link here that you can access to and what the search bar looks like. It's a public web facility of Google Search that shows you how often search terms that are put into Google Search are being looked for. So it will show you the volume of a particular search term across various regions of the world. You can do this in various languages and look at it for specific time periods. Okay, so you might wonder how exactly does Google Trends put together its data. What it does is Google Trends will analyze a percentage of Google web searches that people are putting into Google Search, and they will determine how many searches have been done for the terms you've entered compared to the total number of Google searches done over that period of time. A couple things to note here. Searches made by very small amounts of people or terms that have too small of a volume will not appear. Google Trends won't show you that data if it's not a very popular term. And also, it's good to know that Trends will eliminate repeated queries from a certain user over a certain period of time. So say there's someone sitting at their computer and they search for the same search term, let's say depression, 5 different times in the same day. Google Trends will not count that 5 times, it will only count it as 1 since it's happened in such a small period. So that's good to know. I've got some different metrics here you can see that you are able to use to kind of personalize the type of search you're doing. So if we can see, let me pull out my little pointer here. You can search by a web search, image, through Google News, Google Products, or YouTube. You can search worldwide, or you can get down to some very specific regions. I'll be showing some examples of that. You can search for the past 10 years or much smaller amounts of time, and even specific periods of time, which I will show. And you can also search within specific categories because, of course, specific terms might mean different things depending on sort of the genre or topic that you are concerned with. And of course, I'll have an example of that. When you first go into Google Trends, everything that is in the bold on the left here will be your defaults, excuse me. So if you would like to search within Google Trends with parameters other than these, you'll have to manually go in and change those terms. So with Google Trends data, what they do, you don't get to see specific numbers in terms of what the real or numbers are in reality for a specific search term. What you do is you will see normalized data from Google. So what this means is that to make it easier to compare search data, results in Google Trends are normalized, and if they weren't, regions with the most search volume or the most populated, as you could picture, would always be ranked highest. And so Google Trends will try to normalize their data so that you're seeing a more accurate look at the data, even if an area doesn't necessarily have as many people. So this would be really useful if you're looking at rural areas compared to urban areas, of course, or other things like that. So given that Google Trends normalizes its data, it's important to keep in mind that Trends data is always relative and not absolute. This means that some terms may not appear in certain areas. The data for it may not be available to you. That doesn't mean that term is never searched for. It just means it might not be as popular as other terms that Google has more data on, and that's what they'll be showing you instead. Okay, so I'm about to pull in the share screen in a moment here. So let's pull that up right now. Just give me a moment, and the first thing I'm going to show you is the type of data that Google Trends would show you. Okay, just a quick shout out to Dr. Leverage or Courtney. Can you guys see what I'm? Oh no, you can't. I gotta pull the window over. And let's share my screen one more time. Okay, are we good?
You're good.
Okay, great. All right. So just to give you a quick example of all of those things that I just mentioned, I've pulled up Google Trends here, and I'm going to start with drugs. Let's say you're very concerned about illegal drug use. in a particular community, and so I'm going to start with a more general search term, drugs, and then I'll mess with these different parameters to get to some more specific things I'm interested. So as you can see, like I mentioned, I've got my defaults here. Right now, it's going to show me data for worldwide, the past 10 years, within all categories, and for web searches. So what I would like to do is look at some metrics in Google Trends for this term drugs for one of my CAPE communities. So first I'm going to go to United States, and I am going to choose Clark County, Nevada, which is very close to Las Vegas. So I've clicked on Nevada, and you'll see a map over time up here. First it's giving me, and this represents the rising and falling interest in this search term over this 10-year period, because so far I haven't messed with that. So as you can see, I have years here along the bottom, all the way from 2004 all the way to 2014. However, I don't see specific numbers along the vertical axes, and that's because it's showing me normalized data. If I were to run my mouse along this trend line, I could see for a specific year, it will show me numbers from 1 to 100. And that's how it normalizes its data, is normally in scales of 1 to 100. So I could go along any point in this trend line and see relatively the volume for the search term, how many times people have searched for this. So November 2008, it's showing me that the search term has a volume of 67 compared to in May 2004 where it was at 100. So we can see here there's a slight fall to this trend line over time. If I go down further, I can look at various types of regional interest. And as you can see, currently this does not look very much like the state of Nevada. And I can do some things in there to sort of reveal the state lines a little better. I'm going to talk more about how Google Trends does regional breakdowns in a little bit, because it's very different than how we would normally see on a map. So I said I'd like to go to Clark County, and I know that's very close, that's within the Las Vegas area. So I can get down this, this small. I can zoom in this much to these types of areas. And so actually, before I say any more about the regional interest, there's one last thing I wanted to note for all of you when you're looking at the trend line over time. You might have noticed that there is something that says note right around 2011. And Google Trends simply makes this note that they made some sort of improvements to their geographical assessment around this time period. And so if you see perhaps some vast differences from before or after, they want you to know that it might be due to that. You can click on it to learn more. It will always be here in the trend line to remind you it's there. Okay, returning back to our regional interest. As you can see, I have some blue dots. What these blue dots represent are different cities within this regional area that I'm looking at. So in this case, I'm in the Las Vegas, Nevada area. And over here, I see a listing of different cities. And again, it is showing them in comparison to one another for the volume of our current search term, which is drugs. And it's normalizing that data on a scale of 1 to 100. So I know from looking at this data that Las Vegas has the highest search volume, and then my second runner-up would be Henderson, followed by Spring Valley, etc., etc. It will show me up to 10 at one time, but I don't know the specific numbers for what those volumes are. Anyway, these different cities that I'm seeing here correspond to these blue dots over here, so that I can see a visual. For ones that are clustered very close, of course, Google Trends will let me zoom in and kind of give me this magnified view to parse through the dots a little easier. It's intuitive, but I'll describe for you anyway that, of course, smaller dots mean places with smaller amount of search volume, larger dots mean larger amounts of search volume, and darker blue simply means more and lighter blue is less. And so you can sort of see a visual representation of the list of cities for this area they're pointing to over here. Okay, we're going to scroll a little bit down and look at one other piece of data that Google Trends will give you when you're looking at specific terms, and we're going to look at what it calls related searches. So when you search for a term in Trends, you'll see searches related to the term that you've inputted here at the bottom of the page. So top searches are popular searches that are similar to the term that you have entered. So where does Google Trends get these top searches from? Basically, these top searches will have shown to relate to the term you've entered in some way. So that might be based on category, country, or territory. And if I didn't put in a search term from the beginning, then Google Trends would give me various popular terms that maybe weren't related to each other. But since I have put in a specific term, it's giving me related top searches related to that. So for instance, I've got prescription drugs, effects of drugs, illegal drugs. So even though I put in a very broad search term to start with, Google Trends is giving me some data that might let me see some more specific things that I'm interested in. So if I'm interested specifically in illegal drugs, I can see where that search term rests in relation to other types of terms. So prescription drugs is topping my related searches right now. It's being searched for a lot. And I could click on this, and it would give me data for that search term instead. As you can see, it's a much more specific term, and so I have a much smaller trend line for prescription drugs, and I only have one city that's really ranking for it. So keep in mind, this doesn't mean that other cities don't have people that are searching about prescription drugs online. It just means that in relation to Las Vegas, they don't rank high enough to show up for me. And down here, oh, thank you so much.
And also, what are things normalized against?
Mm-hmm. Okay, so why does Las Vegas have a score of 100? That means out of all of these different cities that are near one another in this regional area, Las Vegas has the highest volume of search for terms for drugs. So the most people have looked for drugs compared to all these other places. And then Henderson would be second. And all the way at the bottom here, we have what they're calling North Las Vegas and Paradise. And so, as I mentioned, it will only show you the top 10. In Google Trends, there's a way to see more. I'll show that in a moment. So Las Vegas has the highest search volume for drugs, and the ones at the bottom have much less. And what does it normalize against? It normalizes against the total number of search terms people are putting into Google overall. So it's not just drugs. It's comparing the number of search terms for drugs compared to any search term that people might be putting into Google for this specific regional area and over this specific period of time. Hopefully that answers your question. If not, please give me a follow-up in the chat box, and Dr. Leverage can alert me to that. Okay, we were talking about related search terms, and there's a couple other things I'd like to note here. You can search for multiple terms at one time and look at the related search terms for each of them. I'll show you that in just a little bit. You will also see over here that right now I'm in top search terms. However, I also have another window to look at these at, which is called rising. And so the difference between top search terms and rising search terms is that Google will look at how rapidly specific terms are rising in interest and label those as rising versus top, which are currently, when you're in Google Trends, already at the top. So for instance, I've clicked over to rising and I see various different search terms have come up for this area. And so I've got terms like Canada drugs. A couple of them are the same. I've got effects of drugs and illegal drugs. Those were also on my top list. And over here, I've got this term that says breakout. So for each rising term, Google Trends will either give you a percentage of the term's growth over this period of time I'm looking at, which I currently don't see, or I will see this term breakout instead of a percentage. And what that means is that this search term has experienced growth greater than 5,000% over the period of time I'm looking at. So if we remember, I'm looking at the past 10 years, 2004 to 2014. And so these are terms that Google Trends is calling breakout, which means over this period they have increased in interest of at least 5,000% or more. Now this may not mean that they have enough data for me to look at necessarily. So let's see, if I click on Canada drugs, yeah, this can happen sometimes. Even though the search term is rising in popularity quite a lot, Google Trends still does not have enough search volume to show me specific graphs about this search term. And of course, then it tells me, try related search terms, try to get more general, try to use fewer search terms in what I'm looking for. So it can be interesting to play around with that and see that even if something is rising very rapidly, it's still not enough for Google to give me very much information about it yet. Okay, so I did mention earlier that it is possible to look at more than the top 10 related searches. And so the way to do that is to go to the top of your screen and in Google Trends, and you'll see this gear at the top right up near the search bar. And if I click on that, I have this option that says download as CSV. If I were to click that, I would be able to download a spreadsheet based on the parameters that I'm currently looking at within Google Trends, and I would be able to see more than the top 10 searches and more than the top 10 rising searches, as well as some more detail about this other data that Google Trends is currently showing me online. So that option is there if you'd like to see more than what Google Trends is currently showing you. Okay, one other thing I'll show you before we move on to some other things in this screen is that regionally, you also have an option to look at different things over time. Let's put in a different search term for a different area. Let's go to Missouri, and let's say we are interested in mental health. Okay, so a vastly different topic in a vastly different area, the same types of data, interest over time, regional interest, related searches. One thing you can do is look at how regional interest has changed over time. So it's sort of a combination of these first two pieces of data. Hopefully this will show up well in the screen share. As we can see, if I look at view change over time near my regional map, I can click on it, and then I can hit play. We'll see if anything shows up. Oh, yep.
It came through for me.
How well were you guys able to see that on your side of things? Okay. All right, hopefully it did. So that's one fun thing you can do is, of course, the areas that we saw, and I realized this does not look very much like Missouri, because Google Trends has this odd way of sort of designating different areas. But we could see which regions of Missouri got darker and lighter to show that over this 10-year period that I chose, to see when there was a lot of rising interest and then when interest, went decreased. Besides watching it play, I can also go back to specific periods if I grab the little thing here and drag with my mouse. So I can see this is July to December 2010. I can see that mental health was of a lot of interest in this specific area, which looks like they're calling this the Kansas City, Missouri area. And in fact, this is an area I would look at if I wanted to find one of our Cape communities. So that would be handy for me to know if I'm interested in a city that belongs to that particular region. All right, I said there are a lot of features. I think I'm at least going to show two more when it comes to looking at single search terms. So what I'd like to do now, let's pick a different search term. I'm going to go to West Virginia, which is also the home of one of our Cape communities. And for instance, let's say this community, local leaders are interested in looking up what people are interested in when it comes to oxycodone, which is a prescription drug that people are known to abuse, to use it for non-medical reasons. Okay, so I'm in a new place, West Virginia. I'm looking at a search term, oxycodone. Going back to our interest over time here, there are two other features that I'd like to show you briefly. The first is that Google Trends allows you to look at different news headlines that occurred over the time period you're looking at that includes the search term you are looking for. So if you can see, there are two boxes I could check over here on the right in my interest over time trend graph. And so if I click news headline, I should see some alphabetical letters show up for specific points on my trend line. And these represent different headlines that should have the term oxycodone within them. So for instance, I'm hovering my mouse over the letter D, and I have a headline from the San Francisco Chronicle that says Pyridone might be the answer for 3/4 of the prescription drug abusers in the U.S., Vicodin, oxycodone, and Percocet? Percocet? I don't know how to pronounce that. So if you know certain events have taken place that probably have news headlines related to them, you are able to see where those occur within your trend line. And it's interesting to see sometimes how they may or may not correlate to spikes in interest in the search term that you are looking for. So for instance, over in the C headline for the letter C, Walgreens to pay $80 million for oxycodone violations. I can see that shortly after that I had a spike of interest, and another headline, police seize marijuana, oxycodone, hashish, and rate of this specific home. So that's one thing you can do. It's an extra piece of data. Secondly, the other box you can check is called forecast. And so if I check this, Google Trends will give me an estimation of its best forecast for how interest in this term is going to look over the next few months. It looks like it's about a 6-month period. This is probably the feature that I have used the least. I know it's there, but at least in my work, I haven't had so much need to try and guess what the forecast might be. But it might be very interesting for you to check a forecast and then see later and look back and see if Google Trends was correct or not. Real quick, I'm gonna check. Okay, I just wanted to check for questions. Okay, so I've showed you all these different features, basic components of Google Trends looking at one search term. Another option you have, though, is if you see over here, I can add a search term even though I'm already looking at one. And Google Trends will let you look at up to 5 search terms at one time. So let's look at a different area real quick. Let's look in the Kansas area where we have our Finney County Cape community. And let's say you're very interested in illegal drug use in your area, and you want to compare a few different illicit or illegal drugs and see what people are searching for or how they compare to one another. So I'm going to put in a few of them at once. First one I'm going to look at is marijuana, and then I'll choose cocaine, heroin, meth. I'll put in methamphetamine. Let's think of one more. I'll put in oxycodone again. Okay, so I met my limit. I've got 5 different search terms, and I can see that for this particular area, I now have 5 different trend lines on my interest over time graph. And they're in different colors so that I can parse through them. I have marijuana in blue, I have cocaine in red, heroin in yellow, methamphetamine in green, and oxycodone in purple. I'm sure there's no surprise here for any of us that marijuana has the highest amount of interest over this time period, and we see a few spikes over here around 2013. I could check news headlines for all of them and see what pops up. Looks like this article is related to Justin Bieber having marijuana. This shouldn't surprise us, though. For one of these other spikes, we see a headline that says Colorado, Washington, first U.S. state to legalize marijuana. For these others, it looks like methamphetamine and cocaine are sort of very close to one another and how they've been trending over time for this area. And then lower than them, we have heroin and oxycodone with similar trend lines down here. If you'll notice, it looks like around 2008, the trend line for oxycodone up until this point was flat. Now that doesn't mean no one was searching for oxycodone. We have to remember once again that Google Trends normalizes its data, so what it's showing me right here is a graph with all of these terms in relation to one another. So I could pull out any one of these terms, look at them by themselves, and I would probably have a more detailed trend line. But what this is showing me is that compared to these other search terms up until 2008, the amount of people searching for oxycodone didn't even really get on the graph compared to some of these others and the amount that people were searching for them over time. So I could also, look at some forecasts for these different trend lines. I can do all the things that I was doing before. Now that we go down to regional interest, I can see that all 5 of these terms are here, and I can go between them and look at different regional interests for them. I can switch between a metro and a city view. I can go down to more specific areas if I want to, at least as Google Trends allows me to look at specific areas. So I can go down and I see that Garden City appears on this regional map for marijuana, and Garden City is within the boundaries of Finney County, which is one of our Cape communities that I would be very interested in looking at. I could see that how it compares to some of these other cities. However, it's not present for cocaine, nor heroin, nor methamphetamine or oxycodone. So these will differ on my different search terms, of course. Lastly, I have all 5 terms down at the bottom to see what their related searches are. For oxycodone, I have hydrocodone. For methamphetamine, it shows me the difference in how many people are looking at meth versus methamphetamine. And we'll touch more on that when we discuss search terms later. So in short, you can do all the things that you might wish to do for a single search term as you might for many search terms. Okay, given that, we're going to take a quick break from looking in the screen share, and I'm going to come back to my PowerPoint. Okay, so you saw my different examples of how I was looking for different types of terms. There are a few more details that you can keep in mind if you'd like to be very specific with the search terms you're trying to look at data for. So I've just put a few examples here. So I've used this example of depression glass. So let's say you're very interested in looking at the volume for searches for the term depression in a certain area. However, you also notice that the term depression glass is very popular. And so you want to make sure you're looking at data for depression in terms of a behavioral health issue and not as a type of glassware. So a few things to keep in mind is that in Google Trends, if you just type a term as it is, without any quotations or anything else, it will give you search terms that may be very specifically what you've put in, or it may be related search terms that look very similar to those results. So for instance here, if I just were to type in depression glass, it might also give me data related to red depression glass. Now if I put that term in quotes, Google Trends will give me data only related to exactly that search term as it is quoted. So if I'm really interested in glassware, then I can put in depression glass and I know I won't be getting my behavioral health related depression if that were what I wanted. Another thing you can do is you can add a plus sign between 2 different terms or more. And if you do that, your results will include searches containing the words depression or glass. And so that might be something you're interested in if you're looking at 2 different issues separate from one another. The last thing that you might try to do and see what type of results you get is to include searches containing a minus sign. So if I put in depression minus glass, I would ensure that I'm not getting any results that are related to glassware, that they're only related to depression, because I've asked Google Trends to exclude any searches that might have the word glass in relation to depression. So this might be handy if you're playing around with search terms with your topics that may have many different phrases that are related to the same thing, or if you're worried there might be some confusion in the results you're getting related to one topic or another. One thing to also do in order to ensure you're looking at results for the thing you're actually interested in is to choose a category for the search term you're looking at. So I might put in the word, let me think about this. I had a pretty good example the other day. Oh, I might look for the word depression, and I might see, oh, here we are, it's right there. That works great. I might choose a specific category, like for depression, I might ask that I only get results under the category for health versus any sorts of categories. And that way I can avoid terms like depression glass or the Great Depression or anything that I'm not actually interested in the work that I'm trying to do. So real quick, I just wanted to show you a screenshot of some of the different types of search terms I've been using to look at different types of behavioral health issues. Another thing to keep aware of, and we saw a few examples of this already in some of the examples I've showed you with the screen share, is that there might be many terms that are referring to the same topic, and they might be in different use depending on the time period you're looking at and the area you're looking at. So meth is a different search term according to Google Trends than methamphetamine. Or the acronym PTSD might be, or definitely is, a different search term than looking for post-traumatic stress disorder. Now, for different, for instance, under alcohol abuse, depending on the area you belong to, different search terms might be more popular to refer to this topic. So if I'm in one area, I might choose to look at a couple of these at one time, and I might see that alcoholism is very popular, and something like binge drinking is not. Or it might be the other way around. And so, number one, it can be handy to know what search terms or what type of language or phrases are popular in a specific community. Or if you're looking for one and you notice that there's top related searches with different search terms, you might discover that phrases that are very popular in the area that you weren't aware of. Right, here was the example. I've got my screenshot of looking for depression, and I've got some things that I'm definitely interested in, but I've also got things like the Great Depression, which I'm not. If I adjust for the category of health, and then I'll have top related searches all related to the thing that I'm interested in. Any questions about using specific search terms? If anyone would like for me to say more or show an example, or if something was unclear, you can put that in the chat box.
Yeah, if you wanted to see a search real time, go ahead and put a couple search terms into the chat box, and maybe Jessica can do a quick one on the fly.
And if not right now, I can definitely offer this again at the end. All right, well, I don't see anyone typing. If you think of something, feel free to put it in. And if not, we'll return to this at the end, and hopefully we won't have any more technical difficulties as I go through. Okay. All right, we've also seen some previews of some of the limitations of Google Trends, but we'll go through some specifics right now. Google Trends is not, was that a question we just got up there? Can you get Google Trends to combine, say, two terms that mean the same thing? Yes, you probably can. Let's see, if we go back to this little chart I've got here, what I might do, for instance, is I might put in, if I want to look for results for meth and methamphetamine, because I want to include both ways that people might be typing them, what I could do is I could write meth + methamphetamine. And the results I would get would include both of those search terms together. That's something I could do to include those in my same results versus seeing them as two different trend lines like I showed you guys before. Okay. So trends data, it's not available for all regions. It reaches as far as Google reaches, and they say that they're always, of course, working to increase their global coverage, but that takes time. And so you might have better data for some areas than others. The United States is obviously pretty well covered. However, if you're looking for data in different countries, you may not have the same kind of luck. I also mentioned this at the beginning that Google Trends will exclude searches made by small amounts of people that have very small search volumes. I've found a way to cheat around that a little bit by doing the comparing multiple terms at one time. While it may not give me a trend line for a certain term by itself, if I ask Google to compare it to 4 other terms, it might actually show me a little bit of a trend line for it. But that doesn't mean it will give me regional data or related search terms or that type of thing, because it just doesn't have that data on it. All right. So then here's just some details about the types of trends data that vary across regions. So the availability of looking within certain categories might be very different depending on where you're looking. Also, the availability of data that might be specific to image searches versus news or YouTube, that might also differ. So that's good to keep in mind, but what I really wanted to cover in more depth in terms of some of these limitations would be regional breakdowns. And so we've seen a couple examples of this already. I'm going to return to sharing my screen, so hopefully we won't have some of those difficulties again. Maybe they weren't even related to me sharing my screen, but okay. So I'm back in here sharing my screen. I'm going to get rid of the last couple of things that I was looking at. As you might guess, urban areas, areas that are highly populated, they have a pretty good regional breakdown in Google Trends. So I'm going to look at Louisiana, and I'm going to look at domestic violence. And if I go down to my regional interest graph, I see a pretty good representation of the state of Louisiana. It looks like how I'm used to the state of Louisiana looking. That still doesn't mean that regions within Louisiana are separated necessarily by counties. However, I've got the New Orleans area, Baton Rouge, Lafayette, different things. I can be pretty comfortable looking at this, especially compared to a map, if I have it also pulled up, if I'm looking for a certain area within Louisiana. However, areas that are either more rural or where people are just simply not nearly as concentrated, I might not have such an easy time if I'm looking for specific areas within a state. So I'm going to look at Vermont for the same search term, and I don't really see something that looks very much like Vermont right now. If I plug over to my city view, there I can see Vermont pretty well. I've got a couple areas coming up, but if I'm looking at in my metro view, not so much. Thankfully, for the search term, so I can see what I'm looking for. The search term is coming up. And so Burlington would be the city I'm looking for because I want to look at Chittenden County, which is one of our Cape Pilot communities. And thankfully, it has a dot coming up for domestic violence as a search term. If it didn't, though, I might have a hard time finding it in my regional breakdown here. So another hint I have is that Google Trends calls this the Burlington, Vermont, Plattsburgh, New York area, which can be inconvenient because it's crossing a state line. However, In this case, I was still able to find the area I was looking at. Now I'm going to go over to Maryland, where another of our Cape communities resides, which is Garrett County. Oops. No, I'm not there yet. Okay, I'm going to go to Maryland. And once again, when I look at my regional map, I might not be having such an easy time here. So there, I've gone over to my city view, and I've got a concentration of dots. However, Garrett County is way over here, over in the west side of the state. And I don't see any dots for cities that might show up in this county. If I toggle over to my metro view, I can see that Google Trends doesn't even put this area of Maryland in either of the two regional areas that it gives me. If I click on the area, it's actually showing it for me in the Pittsburgh, Pennsylvania area. And I've got Morgantown, which is west of Garrett County, but it's still not the area I'm interested in. So in this case, I haven't had very good luck. And I can get data about areas very close, or in this case, not too close, because I'm over here in this cluster. So that's unfortunate. That's a limitation that Google Trends is giving me. Show you one more example. Let's go to Virginia, another Cape community state. I'm still looking under domestic violence. All right, I've got this blob of regions that looks something like Virginia. Of course, if I go over to my city view, I see the state, and it's given me a few blue dots that represent cities that I can look at. But depending where I want to look in the state, I might be searching around between a few of these areas. So our Cape community is New River Valley, which actually consists of a couple counties together. So I know Roanoke and Lynchburg are close, so I'll go to that area. But what I might find is that I've got some crossover between them. So in short, I may still not be having a very easy time. So the lesson here is while Google Trends keeps improving, if you're looking in very rural areas, you may have a lot less luck with getting down to a very magnified specific view. And that's just something you'll have to play around with to do your best to get data most relevant to what you're looking for. And again, if you're interested in looking at specific areas and how they appear regionally for Google Trends, feel free to put them in the chat box and I'll be happy to look at them for you. A couple other quick mentions in terms of Google Trends limitations. Obviously, since we are in Google, any other searches that people might be putting into search engines that are not Google, we're not going to have that data available. So if people are using Yahoo or Bing or something else, that data isn't in here. The good news is lots of people use Google, but it's certainly not 100% of the online population. Another thing to keep in mind, especially for some of these rural areas, is that the quality of internet connectivity differs. Smartphones will often negate a large portion of this because more and more people are using the internet through their smartphone instead of desktops or laptops or things like that. But some knowledge about a local area's internet connectivity would be good to know. Lastly, Google Trends data ages very quickly. So the searches that I've done for you today, or even some of the screenshots that I've included in my slides, they might look different week to week or at times day to day, because Google Trends is always constantly compiling data based on people putting searches into Google. And since it's always normalizing, it's always relative data, these trend lines and these graphs will look slightly different in very short periods of time. And so if you are planning to do a presentation, say with some community partners, and you do a search a month before you're going to meet with them, and you'd like to show them this data live, like I've done a few examples here with you, you may get a surprise. And what you wanted to show them or what you wanted to highlight that might be of interest to them might look very different. Or it may not be there how you hoped it would be based on what you saw a month ago. So just try to remember that, that this data ages in that way very quickly. And so don't let yourself be caught unawares. Lastly, I wanted to just briefly discuss all of this information in terms of, okay, great, I can look at all this data, now what can I do with it? And Google makes a few suggestions for how you can do this. All the examples I've shown so far are ways you can gain insight into what people are searching information on in terms of behavioral topics, and that's really great. You can share these things in real time, like I've showed you. Google Trends will also allow you to embed them in graphs or widgets online on your website. So if you'd like to share data on Twitter or your website or things like that, people who you're not going to meet in person, you have the ability to do that, and that's very useful. You can use all of this data to create dialogues with your partners about topics that are of interest to them in either of these ways, in person or online. Another thing you can attempt to do is track your impact with certain behavioral health issues. So if you have looked at different types of data, including Google Trends, and a certain issue is really needs community attention and doesn't currently have it, you might consider using Google Trends to look over a certain period of time after you've implemented some sort of behavioral health campaign and see if it's had any effect, if it's had an effect on if people are searching more for that topic online. I have this example here of PTSD in Tennessee. Tennessee is another state where we have a CAPE community. As we know, due to recent events, PTSD has been gaining a lot of attention and a lot of awareness, and we can track the impact of a lot of these different awareness and educational campaigns on Google Trends. So we can see here that since around 2007, enough people were searching for PTSD online that Google Trends had data to show on a time trend graph, and it's been rising ever since. So obviously, if I were a person who was implementing educational and awareness related campaigns for PTSD in the state of Tennessee, I could look here and see that I have some measure of success. People are more aware of this topic and they're searching for it online. And I would consider that a good thing. Lastly, I wanted to offer the suggestion that besides creating dialogues, besides trying to share some of this data or track your own impact with certain campaigns, it's a good idea, I think, to compare your Google Trends data to other types of data that are available. So this could be other social media types of data. For instance, you might be interested in how much people are talking about stress, not only on Google Trends, but other social media platforms like Twitter. And there are ways to look regionally for Twitter. You might wish to compare some of this data to national data sources such as county health rankings, which has data about many behavioral health topics by county. You might also compare it to some of the local surveys that you've been working with, and that's one thing that we've been doing with the CAPE project. Talking with our community leaders, what are they aware of, what are they interested in, and seeing whether that resonates or there's a disconnect with the type of things people are looking for online via Google. Sometimes we found that the community and their leaders are definitely interested in the same topic, and other times we found that community leaders are really concerned about a topic that people aren't looking up information about online at all. And so that can be very telling or provide some direction with what you want to address when it comes to topics in your community. So given that, I would be happy at this time to, if people are interested in any terms and would like to have me search them live for you right now, I'd be happy to do so. I hope you'll go home or when you're done with this webinar, pull up Google Trends and look for yourself at different things you are interested in. Maybe you've been doing that through the presentation already. But Google Trends offers a multidimensional view of different topics and how they've evolved as a result of factors like seasonality, geographic location, and media coverage. And therefore, if you use this informatively and in the context of what you already know about a specific community, it can be another tool to address your community behavioral health concerns and issues.
Well, thanks, Jessica.
So at this time, that's what I have for you. Any questions or comments, feel free to give them right now.
It's a new tool that's out there. I don't think a lot of people have used it very much. Clearly, there's some really positive and exciting things one can do with it. There's also some caveats, and I think you've done a good job of covering those. It would be useful to think about a little bit about how to present this, because it is a sort of a complicated tool in some ways to the general public. So thoughts on that?
One other thing too I'd like to offer is that there are a few academic articles out there where people have used Google Trends data within their paper. And so if you're interested in seeing what other people have done in examples outside of this for an academic study, there are a few of them out there that might interest you.
So Adil wants to see the articles.
Yes, I'd be happy to share those articles. Just give me one moment. Dr. Leverage, is there a way I can share things past this presentation?
Webinar, for example. Related articles or something like that. Adil says he's struggling how to use this data. I think that it is a complicated set of information that you're getting, and so I think one thing is to it depends on your role in the community. If you're trying to organize the community, it would help you. I think one real low-hanging fruit is if you're engaging in the community on dialogue about community behavioral health issues, this would help you kind of frame things. It says yes, people are looking for information about this, or no, they're not. Yes, they're looking for it might mean that there's a problem, or maybe that the awareness has been created and now they're thinking about how to address it. Or it could be that there's just some big news story, some movie star had a problem with it, and so they're looking at it that way. So you have to be a little careful about how to frame this for the community. But it could be used to create some dialogue. Okay, so you're helping the community in terms of economic development. So you might put in terms related to occupations to see what people are interested in, work that they'd like to do, workforce workforce development thing. It could also be interesting to see what people are looking at to do in the community, in terms of recreational activities that would. So thinking about that is it requires thinking creatively about the resource and then how to employ it and use it in the context that you're choosing to do it. And just okay.
And I've just put in the title of the article that, well, at least one of them that I found. That's the title of the academic article that uses Google Trends data if you're interested.
I'm not seeing anybody else typing, so I want to thank Jessica for a very comprehensive and interesting presentation. And this will be archived on the project website at healthbench.info. So.
I'd be very curious if anyone does try to use this in any of their work with behavioral health.